Hello, Thrive Nation. I've got one of my health heroes on the podcast today. I've thought of her many, many days in my other life as a physician because I've recommended her work, her books so many times. In fact, even today, I had a client with so many medications from a chronic autoimmune disorder that she's been struggling with for so long, intractable pain, and just it makes me emotional thinking about this, but I've recommended the Wahls Protocol and the cookbook to this client. And I've got the most incredible person. She's got her own backstory. Her name is Dr. Terry Wahls. Welcome to the Made to Thrive show.
Hey, thank you for having me.
Yeah. Now, Dr. Wahls is a professor of medicine at the University of Iowa. She's written the book, The Wahls Protocol, as I said, How I Beat Progressive MS, as well as the Wahls Protocol Cooking for Life plan to treat chronic autoimmune disease. So not only inspiration and not in teaching, but also empowerment. And my community here in Africa knows, Dr. Wahls, that docere is the Latin root, the etymology for doctor. It means teacher. And not only are you a physician seeing patients, but you're a teacher, you're a person who's empowered many. And I'm truly grateful with so many stories that I could get into, but I want to get into the nitty-gritty of the Wahls Protocol. So give us a brief backstory on just your own personal history with MS.
So I'm going to take you and your listeners back in time. So 20 years ago, I'm out walking with my wife, Jackie. My left leg grows weak, dragging it to home. I see the neurologist next day who says, Terry, this could be bad or really, really bad. So at night in bed next to Jackie, I'm thinking about the fact I've had 20 years of progressively worse electrical face pain, trigeminal neuralgia. And so actually I'm praying for a fatal diagnosis because I don't want to become disabled. And 3 weeks later, I hear multiple sclerosis. And I see the best people in the US take the newest drugs. So I treat my disease very aggressively. And within 3 years, I hear tilt-recline wheelchair. And we get even more aggressive. I take Novantrone, then Tysabri. I'm still going downhill. My face pain is relentlessly worse. But, I'm like, am I really doing everything? I go back to reading the basic science. I decide mitochondria are key. I create a supplement cocktail to support my mitochondria. The speed of my decline slows. Then I discovered a study using electrical stimulation of muscles. I asked my physical therapist, can we add that to my physical therapy, my exercise routine? We do. And then I discovered the Institute for Functional Medicine. I take their course in neuroprotection, which is really hard because I'm having a little bit of brain fog, but I have more supplements. And then, and this is really embarrassing, Steve. Then I finally have this big aha, I've already been doing the paleo diet for 5 years. But I think, what if I redesign my paleo diet based on all of the science that I've been learning on my own reading on functional medicine? So I go back, I redesign the paleo diet, and I spend a lot more time on what to eat as opposed to what to avoid. And within 3 months, and now mind you, at my nadir, I cannot even sit up. And I'm really fortunate the university has redesigned my job multiple times to allow me to staff residents in my zero gravity reclining chair. But 3 months later, after I've redesigned my paleo diet in E-stim, I can sit up. And I am walking with my walking sticks and everyone at the hospital. And 3 months after that, for the first time in 6 years, with my son, Zach, jogging alongside on the left, my daughter, Zeb, on the right, and Jackie following on her bike, I bike, around the block. My son is crying, my daughter's crying, I'm crying. And when I talk about it now, I still cry because that is the moment when I realized the understanding of progressive MS was incomplete. 3 months later, we do an 18.5 mile bike ride. And once again, we're all crying. My kids are crying, my wife's crying, I'm crying. And that fundamentally changes the way I think about disease and health. It will change the way I practice medicine. And it ultimately changes the focus of the research that I do. Yeah, and I'll stop there so we can get back to the discussion.
Yeah.
But, you know, if I hadn't developed this, secondary progressive MS, and had such a terrible course, I would just be like any other professor of medicine doing conventional medicine, teaching residents. And so actually, I am profoundly grateful for the now 40 years of general neuralgia and 20 years of multiple sclerosis, 4 years in a tilt-recline wheelchair. And while I've recovered dramatically, I'm not able to run, be the athlete that I used to be. But I'm grateful for the life that I have because it's been such a gift.
And the thousands and thousands of people's lives that you've changed, if not millions, that you don't even know about. I was speaking to the South African Society of Integrative Medicine that I'm a part of. They've sent some questions that we're going to use. They've used your protocol. I've used your protocol. Many lives have been changed. And it's out of your suffering. And I'm so keen and I'm so eager to listen to your Wahls behavior change plan that you've put in. Why? Because it was the suffering and the disease and the diagnosis that got you to say, I'm in a wheelchair. I've got to research this for myself. I have to look at other options. But how do we translate people transforming their lives before they get to that point? Now, that is the key of transforming
that is the key.
Education.
I'm really grateful for my time at the Iowa City VA, where I took care of veterans. A lot of my patients were on disability, had very limited financial resources, and of course they're exhausted because of their chronic disease. And I was doing my functional medicine way of thinking in my traumatic brain injury clinic and the primary care clinic. Now, the traumatic brain injury clinic, I couldn't order any labs whatsoever, so all I had was inspiration and education. In primary care clinic, I could order primary care kinds of labs, blood sugars, lipids, CBC, liver enzymes, and like that was it. But I was using inspiration, education. Were like, oh my God, you're getting really change their diets in really basic. And they saw that diet style ended up being far more effective than their drugs. Yeah, and then the other staff are, they're still talking drugs. I'm talking biochemistry and turmeric and broccoli and mushrooms and garlic and meditation. But I teach biochemistry first, and then how these lifestyle influences the biochemistry. And the residents are going to be whipshod between the conventional staff and me. So I'm like, they're going to pull me out of primary care. This is too difficult. And they did. But they pulled me out of primary care because said, we want you to have your own clinic because we see the amazing results you're having. Yeah. And so, actually I said, no, you can't do that. You have to have the chief of the staff and the hospital administrator request this because I'm not going to get burned. And 2 weeks later, I'm meeting with the chief of staff in the hospital, say, yes, this is what you're going to do. You are coming out of primary care. You're starting your own clinic. And it was called the Therapeutic Lifestyle Clinic. And this was luxurious because now I had a dietitian to work with. I could design the clinic how I wanted. So I could take the amount of time that I would want. And I could design my laboratory testing. Now, it still had to be just basic primary care labs. But now I got to add in a vitamin D, a homocysteine, and the insulin. Plus glucose, and fasting lipids. And so again, very basic kind of primary care labs, inspiration, education, and we had amazing results. I went to primary care I went to specialty medicine. I went to the pain clinic. And the pitch I gave them, Steve, was give me your most difficult cases, people you're not helping who have a lot of pain, who have a lot of fatigue. And if those are their driving complaints, send them to me. They need to know that I'm not going to be manipulating their drugs. That's up to you. We'll be talking diet and lifestyle. So we got just a handful of folks at first, got amazing results. Then we got a much bigger handful, and then the flood came. And I kept having to redesign and reimagine how I was running my clinic because I wanted to accommodate, figure out how to see everyone that wanted to come. Yeah. So we went from individual visits to group visits to classes to larger classes. And then, I ran this for 3 years. I wrote grants. We were able to add staff. And then I made the decision, I need to take this to the next level. And so I retired from the VA. I created a program to teach clinicians and started working on teaching the public and creating more courses for the public so we could take this to a much, much larger level.
Fantastic. Well done to you. I salute you because you've helped so many people and so many practitioners. I want to take a step back before we look at the Wahls Protocol and we discuss it, is that 80 million Americans have an autoimmune disorder. Mm-hmm. It's almost a combination of cardiovascular disease patients, diabetic patients, and cancer patients all put together. What is happening with autoimmune, the exponential increase, and maybe even for the listeners or the viewers on YouTube, what is an autoimmune disorder?
Well, we'll start with autoimmune disorder. Our body protects itself by ramping up the innate immune system when we perceive a threat. And during that process, we may begin to have dysregulated immune activation that begins damaging our tissues. And if during that damaging process, I start creating antibodies to these damaged cellular structures, now I begin attacking, my myelin, begin attacking my synovium on my joints, may begin attacking my bowels, my skin, and this will go on for at a low level for many years, 5, 10, 15 years. And we now know there's this long prodrome that might have chronic headaches. If you're a female, severe pelvic pain, endometriosis. If you're a male, decreasing libido, erectile dysfunction. And then you get multiple sclerosis or inflammatory bowel disease or rheumatoid arthritis or autoimmune thyroiditis. And you see your doc and they get started on disease-modifying drugs, but they may not understand what are all the factors driving this innate immune activation. And so they don't teach you how to stop that. That continues. In another 5 to 10 years, you get your second autoimmune disease. And so now they try and shift your disease-modifying therapy. And again, if you don't get to the root cause, in another 5 to 10 years, you get your third autoimmune condition. And you're much more likely to have significant disability, much more likely to be unable to work due to severe fatigue, cognitive decline, or difficulty with hand coordination, with balance, with walking. And this overlaps then, of course, with comorbid problems, anxiety, depression, mental health issues, metabolic syndrome, high blood pressure, obesity, diabetes, heart disease. But all of those things, all of those diseases I just mentioned are tied to overly activated innate immune system. And so we could go on to, so why is that happening?
Why is it happening? Why is it so exponentially increasing? And then there's almost the understanding in the sort of medical conventional circles is we just treat the symptoms and we treat it and we don't try and prevent it.
Yeah. Well, if we go back to the Flexner report here in the United States, Andrew Carnegie funded that to create, to shut down a lot of the medical schools that were existing in the United States, to create this biomedical standard that was to support the development of pharmaceuticals, which is sort of interesting. You know, he was developing aspirin and the earliest pharmaceuticals, and created a structure for randomized controlled trials that would be the backbone of understanding physiology. So we've learned a lot, understanding physiology to interrupt a particular step to treat a disease symptom. We've learned a lot, but we forgot that life is incredibly complicated, that our metabolic pathways are incredibly complicated with checks and balances to keep life going. And drugs that act on one molecular pathway will not restore health. They may suppress a particular symptom, but they won't restore balanced physiology.
Okay.
Our innate, when the cells perceive a threat, so damage to a cell because of infection, because of heat or cold stress, chemical stress, physical stress, because I overtrained, the cell is damaged. And if the cell leaks some of the innards, so some of the molecules that live inside the cell escape and get out of the cell. Those molecular compounds are now called damaged associated molecular patterns. They interact with the cell membranes of neighboring cells who realize, uh-oh, my sister and brother are in trouble. I got to call in for the reinforcements. So they change gene expression and activate chemokine to call in the immune cells that will release all of these cytokines to kill the infection, to dissolve the damaged tissues, and so they can build better, healthier cells in the replacement. So now the question comes back, why is that damage occurring? And we understand that there are a variety of insults that can happen. Infections can happen, cold stress, physical stress can happen. But if these insults are happening all of the time, because we have a very toxic, poisoned environment, because we've been eating a terrible diet, and I don't have the building blocks to build my cells, because I have eaten a terrible diet or overused antibiotics, so I have the wrong bacterial species and yeast species growing in my gut, because I don't have enough sleep at night, I've disrupted my circadian rhythm, because I hate my job, because I hate my spouse, because my child has a severe health challenge that I am so frightened and worried about, because my business is failing, because I've lost my job. Yeah. So there all of these factors can disrupt my biochemical processes and trigger that excessive inflammation response.
Okay, right. Now we're going to talk about the Wahls Protocol, but what is the percentage that is dependent on people's lifestyle? In other words, what are the epigenetic expressions that are so important? Because we still have this genetic dogma that it's in your genes and it's not up to you. What is your percentage that is up to the person, which decides whether they get a chronic disease or they get an autoimmune disease?
So for MS, we have about 200, 300 different genes that have been identified as increasing the risk. And there's only a handful of them where there's really substantial risk. For most of these individual genes, the increased risk is about 2%. Sort of collectively, you probably have a couple genes. And so that genetic risk in general even if you have identical twins, so you have the exact same genes, only 30% of the time will both twins get the MS. So we know at the most, it's 30%. For the vast majority, it is much less than that. So between 70 and 90% of your risk for developing MS or another autoimmune disease has to do with the infections that you've gotten as a young person, and all of the lifestyle, environmental choices that you have made over your life. And so I tell my patients, Steve, that the past is the past. The epigenetic stuff from your life, your parents' life, your grandparents, great-greats, that's all in the past. But you have, starting today, the choices that you're going to make. And what I want to help you do is begin making better choices step by step, by realistic, achievable step.
Brilliant. Let's go into the Wahls Protocol. What are the most important things that people can do? I know there's 18 servings, 9 cups of vegetables, but what are the things they need to avoid? Obviously, you said not only avoid, but what do you need to add to your diet? Tell us the Wahls Protocol.
Well, the very first thing that I want people to do is to think deeply about what is your why in life. Because I'm going to ask you to do things that will take some effort. It will be much easier if you have a clear purpose in your life, what you want with your health. And a great question to ask is there someone or something that you care so deeply about that you'd run into a burning building to save? Without even question. If they can't find anything, then I might send them to a mental health counselor to work on that, so they're ready to do the work. And then when they're ready to do the work, we ask, can you go all in on the diet, or do we have to work on stress reduction first or an exercise program first? Now, my preference is that we do the diet first, but now I've come to realize for some folks, working on stress reduction or exercise speaks to their heart more. And so then I send them to the psychologist or the physical therapist, and they do that. If they're willing to go all in on the diet, 100% for 100 days, then they could come work with us with our group classes. And the first thing we teach them is the principles of the diet. We want to know, are you a meat eater or are you spiritually committed to being a vegetarian? Because if you're spiritually committed to being a vegetarian, we'll work with you to address those needs. For the meat eaters, and you could do it as a fish eater or a poultry eater, the principles are 9 cups of vegetables, 3 cups of greens, 3 cups of cabbage, onion, mushroom family, 3 cups of deeply colored beets, carrots, berries. And what are 3 cups? You know, I know most of the world uses metrics and grams and milliliters, and I apologize. There are lots of imperial English to metric conversions that you can find on Google. If you think of your dinner plate, when you cover it, that's 3 cups. So we're asking for 3 plates of vegetables.
Wow.
And I am asking you to not overeat according to your appetite. So remember, I'm a tall lady, 6 foot tall. My patients at the VA were mostly men. So for them, I didn't want them to be hungry. So 3 plates of vegetables, 2 servings of meat the size of their palm. And then so do that. And I just sort of laugh when I would first explain this. My vets would say, okay, now is that per month or per week? And I go, no, that's per day, gentlemen.
Wow.
And then we'll talk about, you could be gluten-free, dairy-free, vegan, vegetarian. Then it's gluten-free grains and legumes cooked in a pressure cooker. If you're, and for many of my folks where finances were a big deal, yes, we taught them how to do this as a vegetarian, where they had only a little bit of meat to make it more affordable. I also want to stress to your readers, people who say, well, I can't do the Wahls Protocol. I'm not a doctor. I'm not a lawyer. I don't have a lot of money. My veteran patients did not have a lot of money. They were disabled, living on very small pensions. living in small rural towns with small rural grocers. And so we taught them how to do this, sometimes as vegetarians. We taught them how to work with their local hunters, because hunting is a big deal here in Iowa. And usually it was pretty easy to find someone who shot a couple of deer, and you could have access to free venison. So get the best quality food that your budget will allow, but eat these radical things known as vegetables.
Great. Now, I had Dr. Stephanie Seneff on the show talking about glyphosate in some of the states like Kentucky. 75% of the rain as well as the air contains glyphosate. We've got a huge glyphosate problem here in South Africa and Africa. How important is it to eat? A lot of my patients are westernized. They live in the city. How important is it to eat organic vegetables and organic meats?
Well, there's no question that you can speed your recovery if you'll do organic vegetables, organic meats, because you will decrease your exposures. And then I would also look at, personal care products. The personal care industry has convinced us that we smell bad, taste bad, that being a human being is something to be ashamed of. You got to scrub yourself, put on all these personal care products. And my response is use soap and water. And if you want to put something on your skin, and olive oil or emu oil would be fine. And you could use coconut oil, essential oils for deodorant if you want. But if you simply took a shower every day, you don't need to do that stuff. And if you use baking soda to brush your teeth with, and a little bit of olive oil or coconut oil to brush your teeth, you don't need toothpaste, and you would dramatically reduce your exposure. If you have a furnace air conditioner, you could put on a very high efficiency air cleaning system to clean your air, because there is a tremendous amount of toxic products in the air that we breathe, even in our indoor environments, because we now have, at least here in the US, our houses are very tight to help deal with either the heat outside or the cold outside.
Okay, great. So if we look at the three pillars, you said the diet, you then said stress reduction, you then said exercise, and then where does Eastham, because I know you did a lot of electrical stimulation.
Yeah, I love electrical stimulation. So I'll talk about that. When I first discovered it, that was 2007. There were 212 papers. Most of them were athletes. There were a few for cerebral palsy, a few for stroke patients. Since that time, there are many more papers using electrical stimulation in a wide variety of diseases. It can certainly help. For athletes I've known for a long time, this is a great way to build more strength and more muscle mass without using testosterone. So it's a legal way to really ramp up your muscles. For people with chronic illness, if I will use eStim along with exercise, so I'm using electricity to increase the intensity of my muscle contraction. At the same time I'm doing a volitional contraction, I can get more muscle mass. I also reinforce the connection between my brain and the muscle, which of course is a problem for many types of neurologic disorders. So it's helping to speed the rewiring of my brain, spinal cord, and peripheral nerves, and it's strengthening the muscles. And it's releasing nerve growth factors in the brain and in the muscle. So the first time I did eStim hurt like hell. It was, I kept letting my therapist ramp it up. And I was impressed with the level of euphoria that I felt afterwards. And this was just a 10-minute session. And my therapist said, it's the endorphins. You've probably not experienced them, since you've not been able to really work out. And so I love doing E-stim for the exercise because I'm a former athlete. And I certainly continue to perceive mood enhancing effects from doing an intense workout augmented by E-stim. So even though, my gait is normal, I continue to do an E-stim session several times a week for the benefits that I get from the nerve growth factors from doing the E-stim. And now I view it more like an athlete who is getting the benefits of more muscle growth without the testosterone.
Okay. So that's E-stim. The exercise, is it walking? Is it aerobic? Is it high intensival anaerobic exercise? What do you recommend?
Well, so I want people to do stretching, to do balance. That's so important for everyone with a neurologic disease. As we age, we become stiff and we progressively lose our balance. So be sure that you're doing that. And then have an evaluation with a physical therapist every year. You may need to be working on hand stuff. You may need to be working on gait stuff. You may have a particular muscle group that you have to work on. So get it personalized. And then, yes, I think endurance a couple times a week, good. Strength training a couple times a week, great. And HIIT. Now, HIIT is the high intensity interval training. This requires tremendous sophistication with whoever you are working with. Because if you are disabled, the HIIT might be a 1 minute experience.
Yeah.
It might be a 2-minute experience. Because when we are doing your intensity exercise, or whatever exercise I start you on, the questions I ask are, how long does it take you to get back to your usual level of function? And can you function normally for you the next day? So if you can't get back to your usual level of function in a couple of hours, we let you do too much. If you can't function normally for you the next day, we did too much. And then we should have the amount of what you've done and provide a longer rest. Even people who are wheelchair dependent, who are walker dependent, who are cane dependent, should be doing exercise. And we need to have a very careful discussion about what is the exercise we're going to have you do. We start really small and we gradually increase it.
Brilliant. Brilliant. Talk about stress reduction. I know that you do a lot of meditation and you started mindfulness and those things. How important is watching your HRV, your heart rate variability? There's a lot of autonomic sort of dysregulation these days. Tell us about that.
No, we have a bunch of devices that we can use to monitor heart rate variability. There's a device that's Oura Ring, for example. There are devices that monitor your brain waves, such as the Muse devices, that can tell you, give you really nice feedback on the effectiveness of your meditative practice. And so if you're into devices, go get some devices. You'll learn a lot. It's very, very helpful. If you're not into devices and you simply want to meditate, there are guided meditations that you can get, such as Calm, Headspace, Square, that will guide you. Or you could learn transcendental meditation. Or, many of my vets simply went forest bathing and went outside, spent time in their gardens, spent time fishing, spent time writing letters to people that they cared about deeply, who, in the military, you lose people. And there is a great deal of emotion about that military experience. And so for many of my vets, free writing about that experience, and they would free write and then burn what they wrote. And the act of free writing allowed them over time to reinterpret the trauma of their experience, forgive themselves for living, and find a way to go forward.
Fantastic.
So there are many ways of doing this. I want people to know that you can get gadgets, lots of fun. You can do it pencil and paper. You can just do it outside. You can do it with meaningful prayer and forgiveness.
Fantastic. I want to talk about oxidative stress because I think this is very, very important. And I think labs are important. I'm a biohacker, as you know, I love the auditing, re-auditing. I think preventative medicine, we talk about it at Made to Thrive to try and prevent, you know, sickness and disease before it comes on, and doing labs earlier and earlier with clients and patients and that. But run us through how important oxidative stress, your labs from the HSCRPs. I've been learning a lot about T3 to reverse T3 ratio, how important that is, oxidized LDL, your liver function test, GGT, how important that is. What are the very important labs that someone hearing out there says, okay, my mother had Crohn's, my sister's got rheumatoid arthritis, my other, you know, siblings had whatever, inflammatory bowel disease. What are the most important labs that they can go and do?
Well, I would come in with some very basic stuff. I would want to get, again, these are things that your primary care doc can easily get for you. Uric acid, you could get ALT, GGT, you could get, again, insulin, glucose, and I would really like to see you get a continuous glucose monitor for a month. See how your glucose responds to the food you're eating. Homocysteine, for sure. You want to know, is your homocysteine up or not? You could get fasting lipids if you can get particle size, the lipoprotein panels, fatty acids. That would be lovely to know. Your omega-3, omega-6 ratio. That could be very, very helpful. Cortisol, if you can get cortisol over 4 hours, so you know your morning, noon, 4 p.m. And 10 p.m. Cortisol levels to know, do you have a normal cortisol response? If your sleep is disrupted, understanding your sleep cycle, and you could do that through understanding serial melatonins, or using a Oura ring or some other sleep monitoring device. I think those things would give you a lot of great information. Depending on the family history, you might do a autoantibody panel. And look, are there autoantibodies already going on? And if there are, now that's convenient, because now, like, okay, so we're in the prodrome phase. And if we can address diet, lifestyle, targeted supplements, we could monitor these biomarkers and make sure they are all coming back down into the optimal health range, and avoid getting a diagnosis.
Sure. Okay.
So, you know, these questions depend on what are the economic resources that the person has. I'm very clear with my patients that I'm only going to work with people who are committed to doing the lifestyle changes. If they feel like they need to see the labs, abnormal labs, in order to maybe justify their willingness to make lifestyle changes, my response is, I'm not the person for you. We can use labs to monitor your success, but if you're not inspired and ready to make lifestyle changes now, I'm not the person for you. Go work with your conventional doc. And when you are ready to work on lifestyle, come on back. Because I don't argue with people over, are you going to eat, you know, follow the Wahls protocol diet and work on the lifestyle things? If you're ready to do it with my help, fine. If you need me to convince you you're not ready, stay with your conventional doc until you are ready.
Right. Maybe you just can expand on HSCRP, how important that is from an inflammatory point of view. Spent a lot of time omega-6 to omega-3 ratio, very depleted in a lot of people. So those two markers are something we're doing a lot more of. Do you have any sort of, view on that?
Well, you'd like to have, so there is sort of a standard CRP that we can use for people who have a chronic autoimmune disease. And I'm trying to sort out temporal arteritis. Do we need urgent intervention? If I'm looking for cardiovascular disease, now I'm looking for a much more sensitive test that now we're looking at the lower range of 5 and less. And you're told you want it to be less than 3. I tell my patients you want to be less than 1. And we keep working at addressing their diet, their lifestyle, targeted supplements, so we get that HS CRP to less than 1.
Brilliant. Your view on vitamin D, the level, I've asked a lot of people, a lot of physicians, I try to aim it at 60 mgs per ml. There's a lot of work, and previously these ranges have changed. I remember many, many years ago, like GGT was supposed to be less than 20. That range has changed. It almost looks like these ranges have changed because people are a lot sicker. The sample groups that they're taking are a lot sicker. Vitamin D being so important, and obviously the research in the Scandinavian countries and those that don't get a lot of vitamin D, where do you aim to have that marker at?
So we look at the reference range, and I tell people you'd like to be in the top quartile for that reference range. I am okay if it goes over that. I'm okay with it going up to 100. If it gets over the top of the reference range, then of course we have to have calcium to be sure that we're not getting into trouble. We know from the MS literature that if your vitamin D is above 40, you have a dramatically lower rate of relapse and of disability progression. And the probability of relapse and disability progression continues to get lower and lower as you go higher than 40. Now, there's concern that if you go above the reference range, are we creating problems that we don't yet understand? So my preference is the 60 to 80. If somebody gets between 80 and 100, I'm not panicking. I'll back the dose down a bit, but then of course I'll get a calcium level.
Great. Let's talk about hormesis. I know you're taking ice baths. I battle with the ice baths. We use the same.
Yeah.
We use the same infrared sauna from Sauna Space. I love my Sauna Space. I've recommended it to a lot of patients and clients. I think it's fantastic because it's electromagnetic radiation free. But tell us about hormesis. My concern with hormesis is people are doing intermittent fasting. They're doing cold baths. They're doing sauna. They're exercising. They've got all these hormetic stresses that are in principle good, but the accumulation of hormesis, the damage that it possibly could cause, and people not really body aware. So they don't really know when they're pushing it too much. What should people do? And what are the big ones that you think? Is it an ice bath? Is it the infrared sauna? What do you think? Is it intermittent fasting that's so important?
So as I think about hormesis, and as I'm thinking about my patients, I try to put it in the context of our ancestral biology, of what was going on when we emerged as a species 250,000 years ago. We could get our food, work really hard to get a lot of physical activity. Then we'd have our food. We'd have a couple days of probably a higher protein diet, lots of fibrous vegetables. We are getting low in food. We once again go do a lot of work. And while we're doing our work getting the food, we are probably in ketosis on the basis of all that work. If you do 2 hours of work, you've burned up your glycogen, you're now in ketosis. It wasn't really the high-fat diet, it was all of the physical activity. Then you come back, you're not working so hard for a couple of days, and you're doing the refeed. The ladies, on the other hand, are probably working pretty hard all the time because we're doing all the cooking. So I'm not quite sure how the rest really worked out, but we probably did get relatively more rest and then relatively more work. And we had warmer days and cooler at night. And then when we figured out how to migrate into the Arctics, now we have to figure out cold. And 15 million years ago, there was the Ice Age. So our primate ancestors, there's some theory that that's when we lost our ability to make vitamin C, and that's why we got into fruit And that's why we lay down all this fat and why we have difficulty with high uric acid, making us more likely to have metabolic syndrome. So I think biologically, stress followed by sufficient recovery is beneficial. We have to be careful, and I'm certainly have been guilty of this much of my life because I, sort of the athletic mind, and I would certainly drive myself much too hard on hormetic stress. I did that all my life. I never had enough recovery time. I probably could have performed much better as an athlete if I had done better recovery time. And then as I was recovering from my MS, I bet I would have recovered faster if I would have paid more attention to recovery time. I explain hormetic stress to my patients that we can do it with heat stress, we can do it with cold stress, we can do it with exercise, we can do it with eating and not eating, but we have to allow our bodies sufficient recovery time from that stress. If we do not, we spiral downward. Instead of youthening, we accelerate our aging. And so with exercise, I can use those questions. Did you have sufficient recovery time so you could function? With eating, calorie restriction is really great for anti-aging, but it's a very strong drive to eat. Being chronically hungry is profoundly difficult. So intermittent hunger is okay. We can do that with intermittent fasting, time restricted feeding, periodic fasting. But you have to be sure that you have a period where you have a higher protein diet so your cells can rebuild everything that got recycled during the autophagy part. So, and I probably have gone through periods, even more recently, where I was doing sauna, ice bath, strength training, HIIT training, and fasting, and a periodic fast for 7 days in that whole period. That was probably inappropriate. I probably should not have been doing that. When I did my 7-day fast, I should have dropped the HIIT training, dropped the strength training, and had more attention on fine motor balance, and backed off on the hot and the cold. It is so tempting. We can get so into hormetic stress that we overdo it. I certainly have been guilty of it.
Okay. Tell us about your ice baths, because I know that you do them. I battle with them. I struggle with them. I think it's just too much on my system, and I prefer the sauna. Is the sauna something that you just, preferably use, or should every single autoimmune patient start looking at, obviously slowly integrating this? We're not saying jump into an ice bath. You start with a tepid bath, a cool bath, but should every single autoimmune patient be looking at some type of temperature hormesis?
Well, I think it'd be really helpful. And for many people with autoimmunity, particularly with MS, heat is very, very difficult. And so I remind people, if any of these hormetic stressors that we're doing cause your symptoms to be worse, that is not the hormetic stress you should be doing. So if heat or cold makes your symptoms worse, don't use that one. Use a food stress, or spice stress, or exercise stress instead.
Right.
As long as those symptoms don't bother you, you could start with your shower or your bath and move the temperature slightly warmer. If you're in a shower, have it a little bit warmer in the beginning, and then turn it to cold. And you could do cold for 5 seconds, 10 seconds, 15 seconds, and gradually increase that time. I set my timer for 5 minutes. And of course, during the winter, the cold is much colder in February than it is in August. So five minutes of cold showers is quite cold. I'll tell you, my spouse prefers my doing the cold shower to the ice baths because she doesn't like the cold legs.
Okay.
In bed, she's like, "Oh my God, you feel like ice. Stay over there."
Yeah. But you found that the cold baths have helped your sleep, your deep sleep.
Oh my
Isn't
gosh.
that right?
Yes, absolutely. So if you take a cold bath, and you could start with a cool bath, then as you get more comfortable, just cold water, and then as you get more comfortable, you can have a bucket of ice. And so I have cold water, then I have ice chunks in the water, and I'll read for 20 minutes, do some pleasure reading.
Wow.
And when I do that, that is the most rapid entry into deep sleep. I have the most deep sleep, and I get the highest quality sleep scores on the days that I do a cold bath. And if I'm having, and sometimes my legs get twitchy with restless legs, and taking a cold ice bath will turn that off, and I'll have much better sleep.
Okay.
So if anyone's suffering from restless legs, which is very, very common in the general population and much more common in people with autoimmunity, cold baths, ice baths are a very helpful tool.
Great. Let's talk about the Wahls Behavioral Change Plan. At Made to Thrive, we believe in health coaches. I believe there's a huge gap or chasm between practitioner and patients, and I don't believe there's enough practitioners for all the patients out there. So health coaches and health agents to help with the transformative journey. How does your Wahls Behavioral Change Plan work?
So this is a 15-step process that we use. And we start with inspiration. People need to hear stories of other people who've been on a similar health journey so they can understand it's possible to change their healing journey. So that's step number one. Then step number two is the person then needs to understand what are sort of the basic mechanisms of why healing occurs. So if you're really skilled, you have metaphors that are understandable and relatable to your audience. So, I have a lot of farming metaphors. I have mechanic metaphors. I have teacher metaphors so that my audience can understand. And then we break down the BHAG. What are your health goals? Why do you want to be doing this? We discuss addiction. We discuss small, achievable steps and accountability. We discuss addiction and emotional and physical dependence, how we deal with that.
Fantastic. Fantastic. Last two questions, Dr. Terry, you've been incredible. What would you have liked to have known, in the beginning of your journey? What is the research or science or even empirical evidence taught you recently in the last 18 months that you wish you knew 10, 15 years ago, or something that you're excited about in terms of the future?
Well, I am so at the end when I was first writing my grants, back in 2009. And I'm talking about multimodal interventions. I just kept getting ripped by the reviewers. My mentors here thought I was crazy. You'll never get funding that way. So I had to rely on philanthropic funding. Now the NIH is beginning to fund some multimodal studies where we're using combination of diet, exercise, stress reduction. So very, very exciting. And there is a much greater interest on what creates health. We've spent billions and billions of dollars on what creates disease, pathology. But to me, the real question is, what are the elements that create health? And by teaching my patients that we'll let your conventional doc take care of your disease, I'm going to show you how to create health step by incremental step. That is the most effective way of treating disease. Okay. And I think the NIH is beginning to understand that that may, in fact, be the most effective way to treat disease.
Fantastic. Last thing is, give us a message of hope with regards to autoimmune. It doesn't look good. The data doesn't look, the research and the science in terms of how many people and early onset. I know what's happening to Hashimoto's thyroiditis, just in the people that I've seen exponentially increasing, starting at a younger age. It just seems that it's out of control. And give us a message of hope. Where is it going to happen? What is going to happen in this area for people listening?
So we are completing what's called a meta-analysis of all the diet studies, looking at how diet impacts MS. And when we publish that, which will be very exciting, I think people will see that diet matters. There is more and more research that diet changes quality of life, changes fatigue, changes mood, and it's a modifiable lifestyle factor that you and all of your audience can control. So the evidence is growing. Meta-analyses are some of the most powerful evidence supporting a particular intervention. We'll see more and more meta-analyses about the power of diet across more disease states. Food absolutely matters. And it's what you control.
Sure. Great. So, Dr. Terry Wahls, I declare favor and blessing over you. Thank you for your time. I know how invaluable it is, all your research, all your commitment and your calling, just your courage to speak out in an area I know, even in Africa and beyond, where neurologists are not open to lifestyle changes often. Your rheumatologists are not open to lifestyle changes, but here you're a pioneer with incredible courage. And yes, you've done it out of the seed of suffering, but you've stuck to your guns and you've stuck to your calling and you've changed so many people's lives. So I'm deeply in gratitude. Many, many thousands of doctors are deeply in gratitude. And I hope that you continue with much, much energy to, in this field of autoimmune so that we can really flatten this curve, which is so important for our overall health and well-being.